everybody? Good. Glad the school's over today. Well, I'm Dr. Lee, Alice Lee, and I was honored to be asked to give the first talk. I'm going to give you a little talk about introduction to emergency medicine.
What is it?
Explosion at a power substation. Multiple burn and blast victims, 3 minutes out.
How many?
At least 8.
Judy, clear the shower rooms. Jerry, get the blood bank to send all their own egg. Dawn, make sure we have enough morphine to wrap infusers.
You want to be an ER doc? This is the fun part.
Morris, triage. 55-year-old man thrown 20 feet against the wall. Use abdominal pain, BP 80 pounds.
Rigid abdomen, probably spleen or liver. Tracy, do a bone egg and hold for the OR.
Open femur, good distal pulses.
Now take this. Judy, get her hands up under the jam. Concentrate the load and cold work. Julia, you're on for burn. I got Barnelli's rig. Good.
Pen on the down, keep them on a high power line. Epi, lidocaine, chip shocks, put them into a system.
Trauma queue?
No, curtain 3. We have to hold trauma for the ones we can save.
27-year-old man, shorted breath, pulse ox 82, decreased breath sounds on the
No
right.
facial
Do
burns.
the thorax.
Okay, set up for a chest tube.
Almost blown up to the elbow, intubated up to 10 FMS. All right.
Sam,
Anything to read? Just some pieces. Go.
Burns over 90% of his body and should explode.
All right, leaders and ringers, let's call the burn surge. Okay, cool.
check the sin signal here so we can move in relation. Set up for intubation.
All right, that gives you a little taste of what ER is like. It's dramatized, of course. Like I said, Dr. Lee, I've been an ER doctor for about 23 years. You guys are seniors, juniors? Juniors? Any freshmen? Sophomores? Wow. Juniors? Seniors? A couple of seniors, okay, good. All right, so what we're going to talk about today and what we're going to answer is a few questions. One, what is an ER doctor? Is it how they show it in the TV show? Is it that dramatic and is it that fast-paced? We're going to talk about why would you want to be an ER doctor and why would you not want to be an ER doctor? And then how do you become one, okay? So what's an ER doctor, ER physician? We are the experts at taking care of all health-related emergencies, okay? That's what we train to do. We only work in the emergency department. We don't work in urgent cares. We don't work in an office. We don't work in a surgical center. We work in an emergency department, typically in a hospital, but there are freestanding emergency departments as well. There's one in Gilbert. We train specifically for emergency medicine. You know, it's not like, oh, I don't like doing this anymore, so I'm going to go to ER. ER is its own specialty. We've been a real specialty for 40 years. Okay, so why would you want to be an ER doctor? Well, there's a lot of reasons. Just a variety of patients. You see babies. You see a 100-year-old patient. I had a patient with a 100-year-old the other day. Really alert, very lucid. It's pretty fast-paced, meaning that you see the patient, you try to decide over a period of a few hours what to do, what the problem is, what to do, and then you're done. It's pretty fast-paced, you know, and life-threatening type of situations like that. What I mean by brains and brawn is that it's a really good combination of surgical and medical specialties, so you use your intellect to diagnose, to think about, and gather all the data to figure out what's wrong. But you get the chance to do surgical things like suture repairs, reduction of fractures. You can put chest tubes in, you can intubate patients. And I'll show you some of those procedures in a bit. You're not on call. You're at work, you devote 110%, then you go home, you devote hopefully 0% to work when you get home. Although that's not entirely true for me. But you get to save lives, you really do. And sometimes you deliver babies, which I've done, it's kind of fun. And there's flexible hours in the schedules. You know, you're not really stuck to the Monday through Friday, 8 to 5 or 8 to 8 schedule. And we get paid well. So just as a typical board at work for me, I've taken out the names, but you know, you see all sorts of variety of patients, right? Swelling the arm, you got back pain, suicidal patients, alcohol abuse. This patient here, she fell, her left wrist is hurting, you take an x-ray, boom, get a fractured wrist, right? Another one down here, 81-year-old, she fell, had a cell laceration, oh, ouch, doesn't that look like it hurts? you gotta bleed, you see that? The
Where's-
white spot,
Where's
what,
the bleed?
the white blood is white on x-rays, well, not on x-rays, on CT scan. And your brain should all be black and gray. Any white is blood. Okay. Chest pain, weakness. Your heart should not be beating like this, right? One beat, pause, 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 pause. Yeah. When's that next beat gonna come on, right? So she's having chest pain and she was weak because she was having too few beats. All right, and then we got, let's see, abdominal pain, belly pain comes in, telling you about their belly pain for a week or so. You get a CT scan. I don't know if you can see, but this bulge here is a huge aneurysm in the belly. I don't know how many of you take this class, but the anatomy class, but you've got an aorta in the middle of your belly. That's the largest vessel in your body, and as you get older, that can stretch and stretch and stretch. That thing is probably, normally it's 2 centimeters like this, that thing's probably 8 centimeters, and it's gonna rupture any minute. And they can die in front of you. Palpitations, people come in to the ER all the time with palpitations. Young people have them all the time. This person came in with palpitations, whoa, a lot of beats. The person above didn't have enough, this one has lots of beats, too many. So that's what I mean when we talk about variety. So Josh says, you gotta tell stories. Okay, I'm gonna tell stories. I got lots of stories. So one summer night last summer, I think, we have a trauma system sort of, and the trauma call came over. A gunshot to the buttock comes in. So we go to the trauma room, and this young guy is looking very stable. They were at a family gathering, just sort of chatting and standing around the picnic table. All of a sudden, he feels this pain in his butt. He's like, oh my God. And so he falls down and he's stunned. They bring him in. And I take an x-ray, scan actually. What do you think that is? That's a pelvis, right? You guys are learning pelvis, some of you in this class. What are those white dots? They were shooting birds on these pellets. And inside the pellet, inside this casing is this little bag full of these pellets. And this is a dime. So you can see, kind of relatively speaking, the size of those things, right? So we get to work and we have to explore the wound. So he really got shot in the butt.
These are great stories. Love them.
All right, so next story.
I know, dear, I'm sorry. Hang on.
So grandma comes in and she's choking and I'm looking in the throat. She's like this.
There's a piece of something right there. I know, hon, I'm sorry.
Could I be grab a hand, please?
You can give her another 100. It's gonna be soft, so it's gonna be hard to get to that. It's soft. I know, I'm sorry, honey.
Just relax. You're good.
So we kind of saved her life, actually.
Wait, what was it?
So that was a piece of tortilla. So grandma's having, whatever party was eating and drinking. She's had a stroke before, so her swallowing is not normal, right? She's 85. She's playing with the kids. And then our call was that grandma can't breathe, or so-and-so, an 85-year-old female can't breathe. Comes in by ambulance, and she's sitting up going, right, and choking. So I put her down with deep sedation, and I look in there with a camera. We have a special camera and look in the throat. So what you're looking at is inside the mouth. She's laying like this. Or actually, she's laying down like this. And so, did you see that pink thing on top? What was that? No, it was the epiglottis. The very big tongue on top. The big red thing is the tongue, but the red thing that looked like a surfboard almost. That's the epiglottis. That covers your trachea. trachea right there. The vocal cords, you see those white lines right in there? You see these white lines right there? See that? Oh, those are the vocal cords. So the piece of tortilla was just sitting kind of right over that. That was pulling it out. And that's actually how people die from choking, because a piece will get lodged in there, go past here, and get down past those vocal cords, and children, and sadly, whatever, tragically, they all die because it walks down there, like in a restaurant or somewhere, you can't get it out. All right, so this is kind of fun. Young man comes in and he's like, "Ay, okay. He dislocated his jaw. So it's kind of cool when you do that. Again, I was standing on a little stool step, and I had my legs over his legs like that. And you put your thumbs in the back of your mouth on their molars, the lower molars, and you have to relax and you have to give them shots to make them relax. Otherwise, they bite you. And you have to grab on the back of their jaw in the back here. Just really try to get it out underneath, and you can reduce the jaw that way. So it's kind of a cool thing to do. And you can do other cool things like reduce the dislocation. Like a boss. Watch this. This is a technique that's around a long, long time, but it's called the Captain Morgan hip reduction technique. Captain Morgan is a type of Rome, I guess.
So you have to go push down, push harder, and push harder. And you're 3 country facts. Okay. There.
Like that? Cool, right? Okay, this one, okay, I hope you guys didn't eat anything just when you came in. But we see gross things too, and the next one is no fun, but it's kind of interesting. We had a guy come into the ER with a bad rotten wound, and he had these things crawling all over it. What is that? Those are maggots. Yeah, so. When you leave a wound untended, it becomes rotted and dead, and then flies, and they drop their eggs and then they grow these maggots. Okay, here. So this will make you feel better.
Just recently I had to go to the emergency room though, and I had some stomach virus thing. I almost called an ambulance. It's weird, even considering calling an ambulance for yourself. You call ambulances for other people, right? What are you supposed to say about yourself? Can you come get me? Yeah, I don't feel so good. Just come on and I'll be lying on the floor. I'm just looking at the phone going, I don't know how to do this. I don't know what to do. It was at night, so I drove myself to the emergency room. That's a nice relaxing drive. No, after you. Merge, everybody, merge. I'm only imploding.